There are 11 major care centers spread out over the Gazelle Peninsula, the bigger ones at Kokopo, at the high school, the showgrounds, the Catholic institutions at Vunapope, Bitapaka and Kabaleo. The North Coast has Live One, Lunga Lunga, Kabaira, Karavat, and inland at Vunadidir.
Although majority of the care centers have received their food supplies, we are continue to collect information about other small groups of people still not being supplied with food, water, tents, and other essential items to help them to mitigate the evacuation problems faced by all of them.
Long time, only people only walk long come long here. I think me at one time, some likely client blow me plan, me play been set him up or some likely committee blow me plan. Long bit of pack community government yet. You know got money talking me plan, that's all. Me play thing him, that's all. Na me play walk him. Na there's a committee, me play walk one time. Blow look out all people long year, long sun, na long night one time. Now yet me play walk long time, long scale him, long way me play at stop. Na by all people long you only can stop one time hamamas. Now all you can feel him sorry too much.
It's been inspiring to see the way the doctors from Vunapope have worked in this time of crisis. They also have been worried about their families, and they've just worked unselfishly, endless hours, and they've shown true love and dedication towards their patients. And especially the nursing staff. The nursing staff, I have so much respect for the way they've worked unselfishly. Many hours of overtime, some not sleeping. It's been inspiring to see their dedication and love.
As a Minister for Health, my first concern was the facilities here in Rabaul, whether or not they could cope with the situation. And instead of going to Port Moresby, I flew directly to Rabaul, getting here first light on Tuesday morning. Of course, I think you can understand with such a major eruption, there were a lot of things that were not going quite right. And I didn't imagine for one moment that I could correct these things. In fact, I'm not on the disaster committee. I'm simply responsible to the national government and to the people of Papua New Guinea to make certain that health facilities are providing the services they're supposed to. I guess being a helicopter pilot, it gave me a slight advantage in being able to move around very quickly, which we put to full use on Tuesday and on Wednesday to go around and check the health facilities in the Rabaul area. I attended the disaster meetings, and whilst there was some confusion, I think it's got to be said that the disaster committee over here were under a great deal of pressure. 10 years ago, they had plenty of time to prepare for an eruption that didn't happen. This time they had an eruption very quickly and no time to really prepare.
What our concern is at the moment is that we're going to get a large increase in the number of diarrhea type illnesses. There's been a lot of work on the public health, and especially from Dr. Melly Sampson, and we've tried to have toilets and fresh drinking water and food in all the care centres. So we're hoping to prevent a large increase in the amount of diarrhea, and as of yet we haven't seen it, but that's my biggest concern at the moment.
All the donations in cash and in kind have surpassed the $1 million kina mark, the United States alone chipping in over $700,000. This is where I leave you. Good night.
Maski Yumi stop, na Yumi die long hit so. Rabaul town, you sweet more yet. Rabaul town, you that's all na me stop.